to be aware of some of the points that are important to us here in our community. As of close of business today, the restaurants in the city of Show Low will be closed to dine-in traffic. It will be takeout and pickup and delivery. Also, all gyms and movie theaters will be closed to the public. So those are some of the things that were implemented by Governor Ducey yesterday, and those will be implemented here in the city of Show Low. It's one of the things that we hate to do, but as we continue to slow this virus down and the threat that it has to our communities, this is what we feel that we will continue to follow the CDC guidelines that have been directed from Washington. So let's go. Brian, do you want to share some of the things from the county updates that you may have? And I'll share some more things with the city, and then Diana will let you share some thoughts that you have from Summit.
Absolutely, thank you.
Okay.
So our public health director and his staff are communicating daily, multiple times a day, with the CDC and the Arizona Department of Health Services. So as they're getting information, they're turning around and sharing that information with all of our community partners. We have separate phone calls, conference calls with our school system. We have separate phone calls with law enforcement and our healthcare providers in the area. So that way everyone's on the same page and everybody's speaking the same language here and coordinating their actions. And so those conference calls are a great way, a very easy way, and an effective way to quickly transmit information and coordinate action. The big focus for our health department right now is disease investigations and contact tracing. So when a patient goes into their provider and it suspects that they may have COVID-19, we immediately begin that process. We don't wait for the testing to be completed. We immediately start investigating where has that person been, who have they had contact with, so we can start tracing back and try to corral that as much as possible. So that's probably the biggest job that the county staff have right now, and the most effective thing that we can do to try to put some parameters around how's it spreading.
Okay, thank you. Diana, do you have some comments that you have? How are things going there at Summit?
Things are going well. You know, it's a different world. So far as I know, there's about 60 some odd cases. The numbers that are being posted on the net are a moving target because things are changing by the minute. As of right this moment, I have not received any positive test results on patients. I will say I've got about 20 test results pending, but of the 10 that I've gotten back, all 10 were negative.
That's fantastic.
So that's good. We have no confirmed COVID patients at Summit.
That's fantastic. You know, how are your supplies? I know that the President has ordered that the supply stock that we have on a national supplies are to be disseminated throughout the state. I know they're shipping them to the state, and then from the state they will put them out to the counties, and then from the counties we will try to get some, you know, to you at Summit. But how are your essential supplies that you have holding up?
Essential supplies are good at the moment. We're utilizing a number of healthcare type strategies to maximize what we have. You know, things like ventilator equipment and all, we're really good on. Our biggest concern is masks. We've had some issues with the public needing masks and unfortunately taking more than the one that they should have on their face. And so we've had to secure our masks to save them, so we have them for staff. Other than that, you know, gowns we're doing okay with. I'm sure by the time they get around to bringing up the supplies from the strategic stockpile, we'll be needing them.
Okay. I know that you guys are closed as of today as far as you've closed any elective surgeries, so anything that's not medically essential for a person's health, if it was something that could be put off, as well as you're closing all of your wellness visits. Is that correct?
Yes, it is.
Okay, and we just appreciate people understanding and their patience and understanding that this is just essential to keep from people gathering and being there. The other thing that's hard with the hospital and visits, if you do have a sick patient in there, we have asked people not to visit, and I know that's very difficult, but if you are visiting, that it's very limited, and to make sure that, you know, the best we can do is for the safety of everyone if we just limit the visits there at the hospital.
This is correct. We're limiting visits to just one immediate family member and no children under the age of 17 unless the child is actually the patient. And of course, you know, if the child is the patient, then we do allow one family member to stay. The thing is, it's a potential COVID patient. They're not going to be allowed to come and go and leave and go to the cafeteria and come back because, first of all, that depletes our protective equipment. But second of all, we don't want them taking the risk of transmitting anything from that potential patient to anybody else.
Right. Thank you. I know, Brian, Jeff Lee from the County Health Services has been very busy, very informative, sharing things with us. And I think as the county has taken a role, they're the first line for health in our community here. And I just really appreciate the communication that you've given us here, the city of Show Low, and everybody in the county that's working hard to keep us informed and to keep us as healthy. Now, we do have 3 cases that are in the northern part of the county that are confirmed cases, and right now those have been tried to be contained. And what is the process if somebody does test positive? There's also backward tracing to try to quarantine as many people as possible.
Yes, that's referred to as contact tracing. So again, trying to find out where that person has been, where have they traveled, who have they interacted with, so we can let them know and trace that back so they can see if they have any symptoms. And so, of course, when somebody's had tests positive, they go into quarantine. And then we do that contact tracing for others. And if you're suspected, the health department does a lot of work with those folks, meaning we check in with them twice a day, where they check their temperature, and we can visually check that through a FaceTime or a Skype meeting. So we're following up with those individuals twice a day to make sure that they're not showing symptoms, and if they do, we can refer them to the appropriate support.
Okay. I just want to talk a little bit about essential services that are changing, just like at the hospital here, the wellness visits, those things are stopping, and elective surgeries. But there are certain services in the county as well as the city that we're kind of changing the way that we do business. We have people that are electing, or we're asking to, where possible, to work from home. Do you want to share a little bit about what the county is doing and how they are dealing with some of their regular routine items that they would normally do?
Absolutely. Wherever possible, we're allowing employees to telecommute, change hours, stagger shifts so we don't have as many people all closely together at the same time. One example is with animal care. With animal care, we're having to cut back on anything but our emergency calls. Simply because we have to redirect resources. So those folks that work in animal care will respond to emergency calls and help law enforcement, but when they're not doing that, we've redirected them so they can help out with all of our other duties as we're doing contact tracing and just answering the phone and answering questions.
That's great. One of the things that we'll be doing here in the city of Show Low, effective Monday, we will close City Hall to foot traffic. We will still have a place where you can call into City Hall. You can still conduct business. We encourage you to do as much as you can through the mail, make payments online or by phone call. So if you need to come to City Hall, we ask you to make an appointment with the people that may be able to do it. We'll still try to keep our building department open, our inspections happening, but it will be on a visit-to-visit basis. It will be done by phone call as much as possible. There are certain things that we do have to interact with each other, but just be aware that we are going to limit as far as contacts that need to be made. Our services will still be there. As far as working on streets and maintenance, our police force, all of those things are still going to happen and be there for the public, but we just ask you, and I think that's true of whatever we can do to cut back on the face-to-face visits with business and with commerce in our community will be very essential and helpful there. And so as we continue to do that, we hope to drive the curve down and be able to limit if there is an outbreak. It's our hope that we can continue to stay safety first in our community. That's the main priority we have, and those are the essentials. I want to really ask our citizens a big favor here. And one of the biggest challenges we have right now is at our grocery stores. And as we try to separate ourselves, but people are still just coming to the grocery stores and they have fear. And I'm going to ask you, the worst thing about fear is fear itself. You make the problem worse as you go to the store and to get more than what your basic needs are right now, or your basic needs that you have. Let's fulfill those needs, but let's not worry about the wants right now, because that will allow us to put the food back on the shelves. It's not that there's a shortage of food because of the supply. The supply is just we can't get it to us fast enough. So please just take what you absolutely need on this basis, and maybe from that then we'll be able to stockpile. Don't be buying more than what you would have normally, and I think we'll be able to return our shelves and our food supply back to normal, because there's some people who were so busy or maybe out of town for spring break, they come back and they go to buy milk and there isn't any, or water or toilet paper. So let's be needful or let's be concerned about others as much as we can, and if we can slow that down, because it makes no sense to distance ourselves from everybody else but congregate at the store. So I just hope that we can string that out a little bit and think of other people. Do you have anything else you want to share about procedures or changes that's going on with the county, or anything that we can assist as a city to help you?
Well, certainly, I think, well, two things. One is just to stay in contact with your neighbors. Take care of you and stay in contact with your neighbors and see how you can help out them if needed. Look out for each other. The other thing is, if you are feeling sick, don't just go to the doctor's office. Please call ahead. By calling ahead, you can let the doctor know or the staff know that you're feeling some symptoms. That way they can be prepared, set up an appointment for you so they can keep safe and other patients can stay safe as well.
Right. Donna, do you have any advice on telemedicine or some of the things that are happening as far as techniques and technology that you have where people can see a doctor through telemedicine?
Well, we have the Summit Cares program where people can use Skype or their computer or their phone and be face-to-face electronically with a physician who can assess and screen. That they can go to summitcares.net for that. We also have this is a cell phone thing. If they text join space COVID-19 to the number 66893, they can get local updates on COVID-19, and those are put out at least daily.
Okay.
So when any changes, Angie, our Chief Marketing Officer, puts out new information.
Great. Donna, we just want to thank you for everything that Summit is doing, for the information that you share, for everybody that's working so hard up there. I know you guys are all doing double time and overtime, and we just want to admonish and thank you for having you in our community and what you mean to us. And it's so wonderful to hear that you're testing cases and those cases are coming back negative so far, and we just hope that continues. Is there anything that we can help you or do or ask of our citizens more to do?
The only thing I would ask is that people please don't listen to everybody on Facebook and all the other social medias. There's a lot of rumors out there, and I think people are being needlessly frightened. Stay calm. We're not testing anybody that's not symptomatic, and that is to be good stewards of the testing equipment that we have. And really, truly, just be calm.
Right. I really appreciate that, because I think calmness is very, very key here of things that we can do. And I just want you to know that thank you, and if you'll let your staff and everybody up there at the hospital know that we're thinking, they're in our prayers, and we appreciate everyone's help. Thanks so much.
Thank you.
Brian, so we're going to go into the weekend here, and some of the businesses are going to close, and we're going to go through a weekend, and things will change. Things have changed, and hopefully we're at the extreme of measures that we've had to take. And I just know that you probably, as a county, you see some of the closures, some of the things that have paid off. It's difficult when our county is so large. We go all the way up to the southern tip of Utah, all the way down to, almost halfway to the tip of Arizona. And it's a very, very large county to be in charge of. And our resources get stretched. And we have Summit, who's probably, a very large medical center, but what other things are happening on the northern part of the county, and how are they addressing with some of the issues that they have on the northern part of the county?
Well, as you said earlier, it really comes down to following the guidelines by the CDC. And I know it's a big change for the governor's announcement of closing restaurants and bars and going to dine-in options, or dine-out options and carry-out options. That's a big change for everybody. But as we work together, and as you said, talked about staying calm and working together, we can help corral this and slow it down. We love our restaurants. We want you to support our local restaurants through the dine-out, carry-out, drive-through options. We want to keep supporting our local businesses, but working together and following those basic guidelines is what's going to work for us.
Right. So long as we continue to work on those lines. And I hope people understand that when we did do a declaration here, it wasn't that there are so many federal funds that are available that will come down from the federal aid, that will come down from the state aid, and we have to document and we have to keep those things accounted for. If we needed to close a building or something, or make adjustments to schedules, those are things that we had to declare an emergency in order to do. By no means is it an emergency to cause panic or to cause fear. It just means that we can make decisions quicker, faster, and continue to do business, because sometimes it's hard to get a majority of a council together so that we can make a decision where a decision could be made. We just recently met with all 10 departments of the city of Show Low. We have a strategic plan in place going forward, and we have assessed all of our valuations of the needs that we have, of the basic services that we'll continue to provide. So I just encourage our citizens to care for one another, encourage us to be why we love this area, love the White Mountains, love the county of Navajo. And may we continue to do our part. May we work together as stewards, and may we beat this because we are the best. And I just want to thank our citizens, and thank you, Brian, for being with us today. And Donna, thank you so much for being with us from Summit. And may each of you have a wonderful weekend, and may it be a change, and may you remember to exercise your own faith and your own prayer, and to help others, and let's be the neighbor that we always want to have next door. Thank you, and may you continue to be safe.